Hello everyone, my name's Charlie. I'm one of the neurology registrars at the National Hospital, and we thought we'd just give you a quick talk about the symptom management in inherited white matter disorders.
Hello, hi, I'm Professor Jeremy Chattaway, consultant neurologist, professor of neurology at the National Hospital, and been involved in inherited white matter diseases for at least 10 years. I also have a significant interest in multiple sclerosis, and as you'll hear, there's quite a lot of overlap in terms of symptom management.
Okay, so just a quick introduction to this talk. We're going to be talking about a few of the major symptoms that patients have told us they'd like us to talk about that impact patients with leukodystrophies. And obviously leukodystrophies are a broad range of diseases and lots of them are very different, but there are common themes and common symptoms that patients have told us about and that we see in our clinics. And although they are disorders of the brain, as you'll hear, there are symptoms all over the body. So we've tried to sort of piece together what we think is the most useful advice to give you and hopefully help you sort of manage your symptoms better and in sort of conjunction with your neurologist. So the other thing to consider is that a lot of the advice we're giving here applies to lots of neurological syndromes, including other white matter disorders. So as Professor Chattaway mentioned, it includes a lot of MS management and symptom management as well. So let's move on to our first symptom, which we were going to talk about muscle spasms. And so patients, as you'll all know, muscle spasms are as a result of increased tone, or what you may have heard of hypertonia. So when there's damage in the central nervous system, it causes your muscles to be a little bit tighter than normal, and that can represent as difficulty moving your limbs or your trunk, or it can represent as additional movements called spasms. So Professor Chattaway, I wondered if you could tell us a bit about how you approach.
Yeah, no, absolutely. So the sort of stiffness, particularly let's say in the legs, can be a major problem. So I think importantly is to start with simple things like stretching, particularly when coming out of bed or in bed and through the day. We feel that things are stiffening up, and sometimes just that act is enough to release the spasm before moving on to medications. Perhaps working therefore with your physiotherapist. I think that's an important person in this. There are a number of medications that can be used to control stiffness or spasticity. For example, these are just names, and your doctors and medical team will know of them. There's baclofen, there's tizanidine, to name a couple. If they're ultimately not successful, then sometimes we use medications that are used for a couple of things, trying to control the pain, so gabapentin and pregabalin. And then we can move on at times to more direct injectable treatments. Botox, you'll have heard about that. That's sometimes used. And sometimes when the spasm is very, very severe and is just not controlled by medications, it's possible to insert what's called a baclofen pump, where a little tube is put into the spinal fluid. It's not dangerous, and a micro amount of baclofen can be used to reduce the stiffness. And those are done in specialized neuroscience centers, but I think in the right circumstance can be very helpful and can allow us to reduce the medical treatment. I mean, the medical treatments are normally well tolerated, but of course with any medicine there can be side effects. But certainly I think spasticity and working with your team and your physiotherapist is something that we should be able to look to control and get a good grip on.
Yeah, and I think that follows the sort of general pattern of what this talk will be, which is sort of educating patients so that there's some things that you can obviously manage at home and conservative steps you can take. Then there's non-medical aspects of therapy, physio and occupational therapy. And then there's the medical treatments and escalated medical treatments, sometimes involving devices as well, like pumps here. So the next symptom I wanted to ask you about was how you approach neuropathic pain. Well, I say pain here, and obviously leukodystrophies can cause pain in any way, and you can increase risk of pain in many parts of the body, unfortunately. But one of the biggest symptoms patients talk about is neuropathic pain, which unfortunately can cause all sorts of symptoms in the limbs in particular. So I wondered if you had a general approach here as well.
Yeah, so as you say, pain can of course be due to many causes, and one needs to never forget the simple causes, the more mechanical causes, spinal causes, and other causes of pain. But if we think about nerve pain, neuropathic pain, then often it's described as burning or piercing or squeezing, and it tends not to respond to standard painkillers. So it's always worth trialing paracetamol and ibuprofen, for example, as a non-steroidal. Never forget those. But then one would often need to move on to more advanced nerve painkillers with your medical team. And again, just to give you names of medications, these are drugs such as gabapentin and pregabalin. Often these are drugs which are used for other things, but we use them in a different way. So another good one is a drug called amitriptyline, which in high doses is used to control depression at, say, 200 milligrams per day, but in very low dose, in micro doses, at 10 milligrams or 25 milligrams, I think can be really quite effective in helping nerve pain. And it's given in the evening, and that can really help the situation overnight and into the next day. So there's quite a lot of different medications, oral medications, which can help pain, and just getting the right one, doing one thing at a time, gradually and slowly increasing the dose. That's important to reduce side effects. And then if it's not working, stopping that, and with your team trialing something else. And there are more advanced ways of dealing with pain, sometimes patches, sometimes infusions, but those will be done in specialized centers. But my feeling is if it's done slowly and carefully, one can really make an impact on nerve pain.
Okay, great. Moving on to our next symptom, and I just wanted to talk a bit about bladder and bowel symptoms here. Unfortunately, patients with leukodystrophies or with any central nervous system disease have difficulty with both their bladder, which can be in terms of storing urine, so they may have urinary incontinence, or actually in passing urine, so they may have urinary retention, or they can have a mixture of both of those, but also with their bowel, which again can be a mixture of constipation type symptoms or of passing too much stool, and having fecal incontinence as well. So we have to think about strategies here, and there's lots about patient education, I suppose, but about other strategies towards managing bladder and bowel symptoms.
So these are difficult and complicated. And they come in all sorts of shapes and forms, as we've heard. So the bladder side, if there's real difficulty, it's often useful to get an ultrasound, a simple ultrasound of the bladder, to make sure that urine is not being retained. And certainly over, let's say, 100 mils or so, it might be worth teaching direct techniques, catheter techniques, to empty the bladder. Make sure also there are not other obstructions such as kidney stones. So I think an ultrasound of the bladder is a simple test, is really important. And then if there's a lot of urgency at needing to go, then again, simple medications such as oxybutynin and solifenacin can be really helpful in relieving the problem both in the day and also in the night. So try and avoid getting up so many times at night, which leads to fatigue and exhaustion the next day and a lot of disruption. So the bladder side. On the bowel side, again, sometimes there's going too often, sometimes there's not going enough, and simple things, looking at the hydration status, looking at what's been eaten, making sure that attention is made to other things which are making it worse, sort of caffeine, for example. And then if it's a sort of more of a constipation situation, then a variety of over-the-counter medications, simple medications, I would start off by trialing those. But I think if it's a complex situation for both the bladder and the bowel, then I think some specialist, starting with primary care, moving into specialist service, attention is needed, because sometimes the interplay in the nervous system with the bladder and bowel is really quite complicated. So I'd recommend that. But there's my view is there's often a lot to be done to improve the situation. So please don't feel you have to suffer alone. I think there's a number of techniques which can help these situations.
Yeah, and I think it sort of raises the issue of when you go to your appointments with your primary care doctor or with your neurologist, is making sure you have a list of things to mention to them, and not ignoring the bladder and bowel in particular, because not only bladder symptoms have a huge impact on life. They can increase your risk of infection, which can make a lot of your other symptoms worse. So it's always worth just making sure you mention these things and actually sort of keeping track of them as you go on from appointment to appointment.
Yeah, I think I'd echo that actually. It's really good when you see a neurologist to say, look, here are the 5 things which are really, or 3 things, or are really interfering with my day-to-day life. You know me, you know my medication. Are there things that can be done about it? Because that's what we all want to do, of course, is to improve the symptom and the symptom burden on you and the people in your family. So it's always a good idea to kind of direct the neurologist as to what really is on your mind, so that they can say, well, I can do something about that, or maybe that's something I can't do anything about. So always do that is a really good tip.
Okay, so looking at our next symptom was memory problems, and memory problems unfortunately impact a lot of patients with leukodystrophies and with other neurological disorders. And I think that sometimes patients think that memory problems refer to just having trouble remembering events that happened a long time ago, maybe in childhood, but actually we talk about all sorts of things when we talk about memory or cognitive disturbances, and that can just include day-to-day problems like forgetting names and numbers, but also can include word finding difficulties and difficulty processing new tasks or learning new information. So I wondered if you could talk about how you think about those things and what we can do to help patients.
Yeah, I mean, again, this is a complex issue, of course. It's cognition, which involves particularly memory or visuospatial, but let's think about memory. I think the first thing is sometimes there is not a fundamental memory structure problem, but it's someone's not laying down memories because there's so much going on. Maybe you're very, very busy, or perhaps you're anxious or depression, and can clearly affect the memory, and it's worth thinking about that because those are treatable things. But if that's not the case, then what can you do, as it were, to improve your memory? And we don't have any magic pills or tablets here, but I think increasingly on the internet or the phone you'll see application apps, brain training, and so I think personally doing one of those for 10 or 15 minutes a day or something like that, or a crossword or Sudoku puzzle, just strengthens up the situation. And I think this makes sense. If you want to run a bit more, you'll do training on your legs, or if you want to lift a bit more with your arms, you'll do some training. So you have to do training on the memory structures. Again, simple things. If the memory is weak, then of course write things down, make lists, use your phone, have regular alarms. So as I said, there's no magic solution there, but I think there are techniques which can improve the situation.
Yeah, I think that certainly a large part of a memory clinic is talking about improving your sort of coping strategies. So when you become aware that your memory isn't as good as it used to be, as writing things down, setting reminders, trying to use a fixed routine, so you're reducing the burden on yourself. And then, as they say, boosting your cognitive reserve, so doing some sort of brain rehabilitation, which is something that we could probably all do with, but certainly when you're struggling, it's sort of where we would point patients to keep their memory going as long as possible, really.
Yeah, no, I totally agree.
We're going to now move on to talking about fatigue. And I suppose there's 2 ways to think about fatigue. One is that there's fatigue that comes from having the leukodystrophy in the first place, so the sort of unknown to the people who don't have it, but burden of your brain having to send signals through areas of damage. And then there's the secondary fatigue, which you get, which we touched on already, which comes from your other symptoms from your leukodystrophy. So perhaps your sleep is disturbed, perhaps you're in pain in the day, which we know is exhausting, perhaps you're having to do other things just to compensate for your disease burden. So there's a huge impact of fatigue on patients with leukodystrophy. And I thought maybe we should just talk about a few strategies or things that we would like to tell our patients today.
Yeah, so fatigue, which is distinct, I think, from feeling tired. I think this is a real sort of almost physical, chemical fatigue from white matter disorders. And that's important to state. I think pacing through the day is very useful. If you think about your reserve like a battery, you have a certain amount, and perhaps you want to use it, do certain tasks in the morning, and then perhaps a rest in the afternoon, then come back in the evening. So it depends on your schedule. So just managing your reserves is important. I think making sure there are not other things that are causing fatigue. If you were anemic, for example, you'd feel fatigued with low iron levels, and so other general medical issues or new medications that have been tried, of course, to improve the situation, or something else are causing fatigue. So really have a look around and say, well, did something change 3 or 4 months ago, and now I'm feeling very tired and fatigued. In terms of, again, the kind of pharmacology and tablets, we're limited in multiple sclerosis, which is a white matter disorder, and then amantadine is sometimes used for fatigue. Something else my patients say is putting magnesium in the bath. So you'll see a variety of things, and sometimes on the internet, and if it looks reasonable and someone's tried it and it's not a dangerous thing to do, then it's worth giving it a go. But before you do that, just have a look. Are there any other extraneous factors that are causing the fatigue? And I think really important is to pace your way through the day, as it were.
Yeah, I think treating fatigue as a symptom is really important. So it's something that definitely in the MS clinic and increasingly in the leukodystrophy clinic, we will ask patients about. But if you are not being asked about fatigue, then bring it up, because I think it's important to track, and it's important to put in place mechanisms. So it's not just, as Professor Chattaway said, it's not just being tired. It's a sort of overwhelming, body exhaustion. And there are things by treating it as a symptom that you can put in place at home. So planning, pacing, prioritizing your work and your sort of your home life, but also saving energy for times when you really need it. So perhaps you will have to reduce at points the amount that you do to save time, to save energy for the next big task that you want to take on. And I think appreciating fatigue will have an impact in your life. Unfortunately, it's something that is really important because it helps you manage day to day. So I think the final symptom we're going to talk about is the psychological impact that leukodystrophies can have, not just obviously on the patient, but also on the carer. And I think that it, again, is going to be something that's a little bit complex, and probably too complex to sort of cover fully in the talk of this length, but just to talk about appreciating it and what options patients might have.
Yes, I think the psychology with a significant diagnosis, of course, is not to be underestimated, and the effect that it has on you and your family and friends. And so all of resources need to come together to support you, as it were, through this journey. And vital, of course, are family members and really good friends. And I think that's kind of the core of it. Clearly, if more professional help is available, then through your GP or other sources, then psychologists and of course the charity, here we are, the Alex TLC charity, are vital, and your neurologist. But I think it's a kind of such a big thing, and it will vary through the years in a way that different resources will be required at different times. Obviously your own intrinsic resources, but making sure that you have the networks, and then if required, professional services can be accessed.
I think, again, just treating it as, unfortunately, something that affects all of us is sort of having times of better and worse mental health, but naturally the nature of the diagnosis and the sort of implications that it can have, but also through the course of the disease and the disease burden, we have to be really mindful of the impact that can have on the patient and on the family, and making sure that your healthcare provider, whoever that is, knows if you're struggling, and also using your other networks is really important, so that these things don't get missed, and coming to your appointment with that in mind, I think, is really useful for us as much as hopefully it is for you. So I just wanted to end the talk by giving you the sort of service email, which hopefully your secondary and tertiary care providers can use to get in touch with us if there's any more information they'd like, but also just to sort of recap the ideas that we've talked about, which is initially identifying your symptoms and turning up to your clinic appointments with lists of symptoms. It's not overwhelming for the neurologist or the specialist. It's exactly what we want. It focuses the consultation on what actually will help you rather than what we think will help us. using online resources like the Alex TLC website, like other resources, and as Professor Chatt and I have mentioned, leukodystrophies have a lot of overlap with other white matter disorders like MS and multiple sclerosis. So using those online resources as well can sometimes be very helpful. And putting into place conservative steps at home before maybe going up the ladder, as it were, to pharmacological interventions and then possibly tertiary style interventions like devices, etc. So we just wanted to give you an idea of how the neurologist will think about those symptoms and possibly some things you can do as well.
So really on behalf of both of us, I'd like to thank you very much indeed for asking us to come and speak. We're sorry we're not there in person. I'm sure we will be in the years ahead. It's very exciting that we're launching this new service. It's been in some sense the culmination of many years of work by many people to put together an expert service that really fulfills your needs. So a very good day to you.
Yeah, thank you very much.